Hello, everyone. We are the negative team of Group 4, and today we will argue that African countries should not adopt genetic passports to tailor public health interventions. A genetic passport is essentially a record of a person's DNA profile, containing information about genetic traits, disease risks, and biological markers. While this may sound futuristic and innovative, in reality it is idealistic and unrealistic for many African countries. Given the economic, infrastructural, and ethical challenges across the continent, we strongly oppose the adoption of genetic passports. Opening statement. Adopting genetic passports would mean spending millions of dollars to collect and process every individual's genetic information. This requires advanced labs, specialized staff, and high-level technology that most African countries do not have. Meanwhile, Africa is facing urgent challenges such as inadequate healthcare, poor infrastructure, civil conflict, economic instability, weak education systems, and low data protection capacity. Under these conditions, implementing genetic passports would not only be impractical, it would be irresponsible. Constructive argument 1. Privacy and security risks. Genetic passports demand the mass collection of DNA data, creating enormous risks in countries without strong data protection laws. This opens the door to hacking, exploitation by corporations, and even misuse by governments. Constructive argument 2. Ethical and human rights concerns. Genetic passports could lead to discrimination. Imagine people being denied jobs, insurance, or opportunities because of their genetic predisposition to diseases like HIV, sickle cell, or cancer. This would violate human rights and worsen stigma. Constructive argument 3. Equity and accessibility issues. Many African countries still struggle to provide basic healthcare. Diverting resources to genetic passports would take attention away from urgent needs like vaccinations, sanitation, and access to essential medicines. This risks widening the gap between wealthy elites and rural or marginalized populations. Constructive argument 4. Cultural and social resistance. Public trust in governments and medical institutions is already fragile due to historical exploitation in medical research. A genetic passport system would likely face backlash, fueled by fears of biopiracy or foreign control. Constructive argument 5. Lack of readiness and cost concerns. Developing, implementing, and maintaining genetic passport programs requires enormous investment. Instead of spending scarce resources on this, African countries should focus on proven, cost-effective interventions such as disease surveillance, nutrition programs, and vaccination campaigns. Constructive argument 6. Potential for misuse. Without strong legal protections, genetic data could be misused for surveillance, profiling, or unethical pharmaceutical exploitation, undermining Africa's sovereignty over its genetic resources. Rebuttal. Our opponents may argue that genetic passports could revolutionize healthcare by enabling personalized medicine. But this overlooks Africa's realities. Personalized medicine is a luxury when millions of people still lack access to clean water, basic healthcare, or reliable hospitals. Adding genetic passports does not solve these systemic problems. Instead, investing in clean water, vaccines, and accessible care would save more lives at a fraction of the cost. Closing statement. In conclusion, while genetic passports may seem appealing in theory, in practice they pose far too many risks for Africa: privacy violations, inequity, cultural resistance, high costs, and potential misuse. African countries must focus on strengthening their healthcare foundations first. We firmly reject the motion that African countries should adopt genetic passports to tailor public health interventions. Thank you.